we have to check out the drip set which we are giving to use for that specific patient. Okay, the drip factor or drop factor are mentioned on this drip set. Assalamu alaikum to all the viewers of my YouTube channel, the Easy Pharmacology, and my Facebook page, Dr. Sayyid Mubashir Official. Today I'm here for a new lecture. What I have experienced from my teaching side, that the pharmacy students especially to whom I teach, so they are facing one of the problem regarding the dose calculation I have experienced among my students. So what I have thought that I should try my best to upload the lectures regarding the dose calculation. So today I'm here with this dose calculation topic. I will try my best to deliver such important and significant points so that the students might understand this dose calculation and they might resolve their issues. So let us start. I am going to start a new lecture series regarding the dose calculation. On my YouTube channel, there are few lectures regarding pharmacology, but on this my YouTube channel, I want to discuss this dose calculation issue because the students are facing such type of problem. So I want to start a new lecture series with the tag of dose calculation, and inshallah I will try my best to upload more lectures, or 2 or more lectures. And I have given them a tag lecture number 1 regarding the dose calculation, lecture number 2, and so on. Inshallah, I will try my best. So today we are going to start that one. So Bismillahirrahmanirrahim. Sallallahu ala Muhammadin wa alihi wa sallam. Dose calculation, lecture number 1, IV fluids calculation. Okay, what the students face the issue. Dose calculation might be regarding different dosage forms, but especially the students they feel a problem regarding the IV route of administration, especially fluids, especially the IV fluids, intravenous fluids and medicine given through this route. So how to calculate the dose of the patient, how much IV fluid should be given, and so on. So in this lecture, what I want to cover, the contents of today's lecture are infusion rate, what is infusion rate, what is drip factor, or what is drip set type, and what is IV flow rate or drip rate. So I will try my best to cover these basic concepts. Okay, let us start from infusion rate. Actually, IV fluids are generally given with this form. Let's suppose the doctor prescribe. Let's suppose the doctor says that you should give this patient normal saline 100 ml per 1 hour. Let's suppose this is the direction or the order from a doctor. Okay, so you see here that what the thing we are going to give the patient, normal saline. This is one of the IV fluid, and the doctor has given these directions. 100 ml we have to give, we have to infuse the patient. How much quantity of the normal saline? Total quantity 100 ml. And in how much time? Total quantity of 100 ml we have to infuse over 1 hour. So here in this order of the prescription given by the doctor, the two things, number 1 quantity and time, both are mentioned, and both are clearly mentioned that we have to give total 100 ml of the normal saline IV. Okay, and we have to cover, we have to end that 100 ml in total 1 hour. Okay, in this direction both things are clear. Let us take another example. Let's suppose doctor says that you have to give normal saline, okay, total 1000 ml IV in 10 hours. Here see the prescription or the order of the doctor. The doctor says that you have to infuse 1000 ml of normal saline, the route is IV, and over 10 hours. In 10 hours you have to complete this quantity of the normal saline. So here what our responsibility, what we have to calculate, what we have to do here, what we have to calculate, that is the infusion rate. Let's suppose here the question is what should be infusion rate. Infusion rate कितना होना चाहिए so that we may cover 1000 ml of normal saline in 10 hours. So now let us understand what is the infusion rate. The question arises, what should be the infusion rate? Actually, infusion rate is what and how to calculate the infusion rate. So there is a formula to calculate the infusion rate. Formula. Okay? What is that formula? The formula, total volume in ml divided by total time in hours. This is the formula to calculate the infusion rate. Whatever the total quantity has been given to infuse and whatever the total time has been given to end that total quantity, we have to just calculate the infusion rate. The quantity might be 1000 ml, 2000 ml, 3000 ml and so on, and the time can be 10 hours, 8 hours. So any time could be over there written by and prescribed by the doctor. But what we have to do, we have to calculate the infusion rate. Now this quantity given, we have to end in this time. So now the need is to calculate the infusion rate. What should be the infusion rate to infuse whole this quantity and whole this time? So that infusion rate is what? Total volume in ml divided by total time in hour. So here the total volume is 1000 ml, and if we will divide with total time in hour, that is 10 hour. So here the answer will be 100 ml per hour. Okay, 100 ml per hour. The unit of infusion rate is ml per hour. Or if I say ml per hour is infusion rate, or what is infusion rate? Ml per hour is infusion rate. So whatever the prescription says, and after that if you are given the question, now calculate the infusion rate, you should know that what does mean by infusion rate. Infusion rate means ml per hour. This is 10 hour total, but how much quantity we should infuse in 1 hour? So if we will do this calculation, 100 ml per 10 hours, it will give the answer of 1000 ml per 10 hour, it will give the answer of 100 ml per 1 hour. So this is the infusion rate. So in 1 hour, if we will infuse 100 ml, so obviously it will take 10 hours to complete the total quantity of 1000 ml IV of the normal saline to that patient. So this is all about the infusion rate. You should memorize this formula. How to calculate the infusion rate? Total volume in ml divided by total time in hours. This is necessary, the total time in hours. Okay. After that, what should we know? That is the drip factor. Drip factor. We also call it drop factor. Okay, what actually this is? Actually, this is the number of drops per 1 ml. 1 ml के अंदर number of drops. ठीक है? So this is known as drip factor or drop factor. These both terms are used for this statement. Number of drops per 1 ml means 1 ml is containing how many drops. वैसे there is an abbreviation GTT. This is also used as abbreviation at the place of drops. ड्रॉप्स की जगह हम ये जो है GTT एब्रिविएशन यूज करते हैं. एक्चुअली दिस इज derived from the GUTTA, Guta. This is one of the Latin word, and Latin word Guta means drops. So mostly if you will see in hospitals, instead of drops, they are using the number of GTT per 1 ml is known as drip factor or drop factor. So up to this you have known that what does mean by drip factor or drop factor. Actually drip factor or drop factor is very necessary to calculate, to know in order to do the further calculations. Now come on to the drip set types. Drip set or also this we call it infusion set. I think you have seen this drip set when any patient is given any intravenous fluid, so they are given through a drip set is set over there, and there is a chamber of drip set, and that is connected with the vial of the IV fluids, and there is a needle, and that is injected into the patient's vein, and the fluid is run through the drip set and the chamber of the drip set and given to the patient. So that is known as the drip set or infusion set. Actually there are different types of drip set. Number one is macro, number two is micro. Now what does it mean by macro drip set or macro tube? We also call it macro tube or micro tube. What does it mean by this one? Before this we have learned drop factor or drip factor. Okay, before this topic we have learned drop factor or drip factor. So those drip sets are known as macro drip set, which are containing either 10 or 15 or 20 drop factor, and micro are what, which are containing or which are having the property of 60 drop factor. Okay, those drip set which are having which have the property or characteristics of 10 or 15 or 20 drop factor, or micro is that one which have the property of 60 drop factor. Now I have one of the drip set. Okay, actually after this topic there is an important topic that is IV flow rate, okay, or drip rate. So for calculating the flow rate or for calculating the drip rate, we have need to know what is the drop factor. Okay, for calculating IV flow rate, we have the need to know that what should be the drip factor or drop factor. So from where we will come to know the drop factor or drip factor. So to know that drip factor, we have to check out the drip set which we are giving to use for that specific patient. Okay, the drip factor or drop factor are mentioned on this drip set. I'm closing this drip set to the camera. Now you can see that here it is written 1 ml is equal to containing 20 drops. Okay, this is one of the macro drip set. This type of drip set is what? This is a macro drip set, because here this 1 ml is equal to containing how many drops? 20 drops. And I also have mentioned here the macro drip set are what? Which are having the drop factor of whether 10 or 15 or 20. Now what does it mean? Means you have seen that when you will start this drip set, so you will see that drops are going to fall by this gravitational force. Okay, so they drops. So it means that 1 ml will be containing 20 drops. Whatever the ml you will start for infusion, so 20 drops will be equal to 1 ml. So there are different drip sets. If you are using the macro drip set, so means regarding this one, 20 drops means 1 ml of the solution will be containing 20 drops. So there might be the different drip set which might be containing the 50 drops per 1 ml or 10 drops per 1 ml or 60 drops per 1 ml. So if that is, let's suppose there is one piece of any stick. Okay, let's suppose its size is 1 meter. Okay, if I will break this piece of the stick into very small pieces, obviously, so it is possible that total 60 pieces I may have from this 1 meter piece of the stick. So if there will be 60 pieces, obviously each piece will be very minute, very micro piece will be there. So if I will use micro drip set, so it will deliver 60 drops from 1 ml, because each drop will be very micro in size. Okay, so it have the property to deliver 60 drops from 1 ml. Okay, likewise if I break this piece of stick into let's suppose uh, something larger size. Okay, so it might contain about 10 pieces. Okay, but if I'm breaking this piece in much more bigger size, it might be 15 or means you can understand this one. Micro means 60 drops from 1 ml and macro means 20 drops per 1 ml or 15 drops or 10 drops. So this is one of the type of the macro drip set, and this will deliver 20 drops from 1 ml, means 20 drops are equal to 1 ml. And in other drip sets you will also see such type of reading over there. So actually the problem is, after this we are going to learn the IV flow rate or drip rate. So for its calculation we have the need to know the drop factor or drip factor. So from where we will get that drop factor or drip factor, it will be mentioned on the drip set. Obviously if you are going to infuse any medicine to the patient, so obviously you will use the drip set. Okay, so on that drip set there will be written the drop factor. So now the drop factor of this drip set is how much? 20 drops per ml. If I'm going to ask from you people what is the drop factor of this drip set, you will say 20 drops per ml. This is the drop factor or drip factor. Okay, and this is necessary to know for calculation of what? For calculation of IV flow rate. Okay, or IV drip rate. Drip rate भी बोलते हैं और flow rate भी बोलते हैं. So for calculation of this one, this is necessary to know, and from where we will come to know? From the drip set. Okay, and there are two types, macro and micro. Macro are mostly used for such situation where large quantities are to be given to the patient and the flow rate should be high, means in very limited time we have to infuse the any fluid to the patient, so we have the need of macro. And for pediatric patients we especially use the micro because very less quantity and in very lengthy time we are going to infuse that one. Depends upon the situation, but especially in children and pediatric patient we use micro drip sets, and where there is a need to infuse larger quantities and in a rapid time, so we have the need of using the macro drip sets. Okay, up to this I think you come to know that what does mean by how many types of drip sets or infusion sets, and what does mean by drop factor or drip factor. Now come to know the IV flow rate. What does mean by IV flow rate or drip rate? So actually what is this one? This is actually drops per minute. Drops per minute is what? This is the IV rate or drip rate. Or you can say that drops per minute is the unit of IV flow rate. Okay, what actually this is actually means how many drops we have to. You have seen this one. I think when any nurse or any skilled person is going to set the IV set for the patient, obviously they set this how many drops are falling into the chamber of this one, so that such quantity should be delivered in such time. Okay, so how many drops are falling in 1 minute? 1 minute, in 1 minute how many drops are falling through the gravitational force? This is known as the flow rate or IV flow rate or drip rate. And how to calculate this one? There is a formula: total volume in ml divided by total time in minutes. Here this is very important because in infusion rate we had used total volume in ml but total time in hours. That is the formula for infusion rate. But for flow rate, for IV flow rate or drip rate, in formula total time in minutes multiplied by drop factor, or drip factor. This is very necessary to know to calculate the IV flow rate or drip rate. Now here the question arises, what is then difference between the infusion rate and IV flow rate? Actually infusion rate is what? ml per hour. Means such ml we have to infuse in 1 hour. Means there are two things. The total quantity, okay, and total means time is 1 hour. You in 1 hour you have to infuse such quantity. This is known as the infusion rate. But how you are going to give the IV fluids? Through this drip set. Okay, so now here there is a need to set such drops, the falling of the quantity, how many number of drops should fall in such quantity so that such quantity should be delivered in hours. The difference between the flow rate, this is flow rate, okay, this is flow rate, and drops per minute. This is IV, sorry, this is infusion rate. Sorry, this is infusion rate, and this is IV flow rate. Okay, there are two things: IV flow rate and infusion rate. The infusion rate tells us about that such quantity should be given in 1 hour. Okay, the thing is clear. But obviously we have to give that IV fluid through the process of this drip set. So we should know what should be the drip rate or IV flow rate, so that we may calculate such number of drops falling into the chamber of this drip set in 1 minute, so that we have to calculate this one, we have to set this one. If we will come to know how to set this one, in this way we may be successful to deliver this quantity of ml in 1 hour. If we cannot be able to calculate this one, how can we come to know that such ml like 100 ml in 1 hour? Now, okay, you have set a drip set. Now, how many drops should be falling from the bottle through that line into the IV chamber, so that such quantity of ml is going to deliver in 1 hour? So obviously, here there is a need to calculate how many drops should fall in 1 minute. If this is calculated, this will give or this will deliver such given quantity in 1 hour. So the formula to calculate this drip rate is what? Total volume in 1 ml divided by total time in minutes and multiplied by drop factor. Here let us do an exercise. By putting this formula, we are going to give an exercise. Let's suppose there is a doctor who prescribes for a patient 400 ml normal saline. Okay, there is a need for the patient to give the normal saline, and the doctor says you have to give 400 ml through IV. Okay, and the doctor says that you have to give this normal saline over 4 hours. Okay, up to this one. Now, if the doctor says you to give normal saline 400 ml over 4 hours, and after that the question arises, the doctor asks that now what will be the infusion rate? In this case, what will be the infusion rate and what will be the IV flow rate? Okay, these are the two questions after this one. 400 ml normal saline over 400. The questions are two. What should be the infusion rate? What should be the IV flow rate or drip rate? Okay. You know the formula for infusion rate: total volume in ml, okay, divided by total time in hour. You know total volume is 400 ml and total time is 4 hours. Okay, this will give 100 ml per 1 hour. Okay, if you will give 100 ml in 1 hour, this will deliver 400 ml in 4 hours. But how you will deliver? Obviously through the drip set. Now there is a need to calculate the drip factor, drip rate or IV flow rate. So for this one you have the formula: total volume in ml divided by total time in minutes multiplied by drip factor. Okay, now here is the need to ask the doctor that you have given 400 ml normal saline and over 4 hours. Now what should be the drip rate? Oh sorry, what should be the drip factor, or what should be the drop factor? So the situation also tells that if there is a child patient, so obviously frequently we are using the micro or macro, but there is a need to ask one more thing, that what we have to put the value of drop factor or drip factor. Okay, so here is a need. So for this exercise, let's suppose the drip factor or drop factor is 20 drops per ml. This is the unit of drip factor or drop factor, 20 drops. For this exercise, let's suppose that drip factor is 20 drops per. Now put the values. Total volume in ml is 400 ml. Okay. Total time in minutes. This is 4 hours. 4 hours into 60. Uh, 1 hour. 4. This is 4 hours, and each hour is equal to 60 minutes, and multiplied by drip factor, that is 20. So if you will calculate this one, the answer will be 33.33. Okay, so this is what IV flow rate. The value is 33. इसको राउंड ऑफ करके हम टोटल बस 33 ही लिखते हैं. 33 यूनिट इज व्हाट? 33 drops per minute. Now this is the answer. If you will set the falling of 33 drops in 1 minute, okay, so this will be what? This will be the flow rate or drip rate. So if you will set this quantity of drops to fall into the IV chamber in each minute, so in this way what will happen? There will be the delivery of 100 ml in 1 hour, okay, and ultimately there will be 400 ml in 4 hours. Okay, you can justify these both things. Come to know. Okay, let's come to justify these both things. Which things? Infusion rate and IV flow rate. Justify both things. 100 ml in 1 hour. This is the flow infusion rate, and what is the IV flow rate? That is 33 drops per minute. Okay. I have said that if you will set the flow rate of 33 drops per 1 minute, you can deliver 100 ml in 1 hour, and ultimately this will give 400 ml per 4 hour. That is what the doctor have ordered. Doctor have ordered 400 ml normal saline. You have to infuse over 400 or over 4 hours. So what we have calculated infusion rate 100 ml per 1 hour, and what we have calculated flow rate 33 drops per 1 minute. You know that if you will give 33 drops in 1 minute, so if I calculate drops in 1 hour, so obviously 33 drops in 1 minute, so in 60 minutes, 60 minutes means 1 hour. This will be 1900, I think 1980. So 1980 drops per 1 hour. 1980 drops per 1 hour. This is same as this one. 100 ml per 1 hour, or if you are going to deliver 1980 drops per 1 hour, this is the same thing. How you can justify? This is ml, this is drops, and you know that 1 ml is equal to 20 drops. 1 ml is equal to 20 drops. If you want to justify these both things, if you want to equalize these both things, the time is same, 1 hour, but here the ml, here the drops, and you know that here we have used 20 drops per 1 ml drop factor. So you can divide these number of drops with 20 ml. Sorry, 20. Because 1 ml is equal to 20 drops. Now 1980 drops will be equal to how many ml? So if you will divide this one, the answer will be about 99 ml. Okay, 99 ml per hour. So this is almost equal to 100, means there is only difference of 1. There might be difference in that one. What would be 33.33 को हमने consider नहीं किया था. So this is same thing, 100 ml per 1 hour or 1980 drops per 1 hour. These are both these both are equal. How? Because if you will divide these number of drops with 20, it will give the answer of 99, because 1 ml equal to 20 drops. So number of drops को आप 20 से divide करोगे तो आपको 99 मिलेंगे. That will be the ml per 1 hour. So the thing is same. You have just two sides you have to calculate. If you are given any query, any prescription, any order from the doctor's side, and that the situation, the scenario of the prescription is like this one, 400 ml normal saline, and you have to give over 4 hours. Now if you are asked that what should be the infusion rate, what should be the IV flow rate or drip rate, so you have the formula for infusion rate. टोटल क्वांटिटी को आप टोटल टाइम आवर से आप डिवाइड कर दें, आपको इन्फ्यूजन रेट मिल जाएगा. एंड ऑब्वियसली हमें ड्रिप फैक्टर और ड्रिप रेट हमें सेट करना होता है कि कितने ड्रॉप्स होने चाहिए 1 मिनट के अंदर. सो यू हैव द फार्मूला, बट फॉर दिस फार्मूला यू शुड नो द ड्रॉप फैक्टर. So obviously you can see through the drip set, or you can ask from the doctor that what should be the drip factor or drop factor. So I think that for today's lecture, the contents what I had written, I have tried my best to explain all these things, and I hope that the students have got the concept. And inshallah, there are multiple other topics to be discussed regarding the dose calculation. But for today, this is enough, I think so, and hope that you all have got the concept. Allah Hafiz.